Hi there, I'm Jason. I'm a registered polysomnographic technologist or a sleep tech. We're going to take a kind of a deep dive, just a little exploration into maxillomandibular advancement surgeries. Should you get one? I am not trying to answer that question for you in this video. I want to make that super clear. Everyone is very different. This is just something to consider. In the comment section, I would love to hear if any of you have had a maxillomandibular advancement operation or surgery. I would love to hear about your experience with it in the comment section. I know so many people viewing this video are gonna really appreciate those comments. So I'm gonna show you a sleep study of a person I've been working with for a very long time. They happen to have tried CPAP. They've tried bilevel as well. They had a maxillomandibular advancement surgery. Then they tried bilevel again with mixed results. Then they had a sleep study with me to see what the hell is going on. This is that sleep study. So this is with no CPAP, no bilevel, post maxillomandibular advancement. So essentially breaking the bones. This is generic, breaking the bones within here, pulling it all forward to try to pull the tissue forward. So this person seems to be suffering from upper airway resistance syndrome, really trying to get away from using CPAP or bilevel altogether. Let's go ahead and take a look at the results. So here we are. Was it successful? Kind of. Anyone would kill for an AHI of 0.2. That's absolutely nothing. That's minuscule. A REM specific AHI of 0. Obviously, you can't get better than that. However, we do have an RDI of 25.3. What is an RDI? It's a respiratory disturbance index. So while the AHI only includes apneas and hypopneas, that's it. You're waking up from an apnea and a hypopnea, yes, then it counts towards the AHI. If you're having a respiratory effort-related arousal or an apnea or hypopnea, that counts towards the RDI. I'll show you what a RERA is in a second, but they're still waking up 25.3 times per hour of sleep. So if you're getting 8 hours of sleep, multiply the 8 by 25.3, that's how many total arousals or awakenings that they're having per night. That's a lot. That is a lot. Essentially, just consider, we're going to round up a little bit. If you're trying to sleep and I come in and I wake you up one time every 2 minutes, you're going to get pissed. You're going to be a little snarky. All right, let's look further down in the report. All right, what we have here is a hypnogram. Really not a lot of it is of relevance, except for right here, you see it says arousals. Look at all these arousals. So we're looking for the awakenings because we just saw that there's a ton of awakenings from RERAs, respiratory effort related arousals, and they are all clustered right here. Now, an aside, well, it's right before 1 a.m. and it persists all the way up until almost, we're just going to call it 3 a.m. So for an hour and a half, they're waking up a ton from RERAs right there. You can see the pulse is also elevated during that point. You can see the blood oxygen levels are kind of all over the place during that point. And we can't really say it's positional because over here we have periods of supine sleep that look really bad, but also periods of sleep on the right-hand side that also look really bad. So it's not really positional. We can't blame it entirely on that. But let's go ahead and take a look right before 1 p.m. Or I meant 1 a.m. So here we are. This is well before it starts. This is stage 3. Nothing going on in the respiratory channels. So let me give you a quick primer. We have breathing, we have leg movements, we have EEG, so we know that they're awake or asleep. And what we're looking for is a big dip in the breathing right before an arousal. So we don't have any of that yet. Looks pretty decent. All of a sudden we have a couple. We have a big position change going on here. They're still supine, but there's a big, I should actually say it's a body position adjustment. And all of a sudden, all hell breaks loose. We can see these decreases in breathing, RERA, rapid gasp of air, and an awakening in the EEG. This is just going to be rinse and repeat for like an hour and a half, 2 hours. Decrease in breathing, rapid breath, leg movement, awakening. Decrease in breathing, rapid breath, leg movement, awakening. decrease in breathing. You get the idea. So let's go ahead and fast forward. It'll make you tired just looking at it. Look at this yo-yoing of breathing. We have a yo-yoing of the blood oximetry, awakening after awakening after awakening. Now, there's a position change. They're on the right-hand side now, and it's the same thing. Decrease in breathing, rapid gasp of air, gasping, leg movement, awakening, over and over and over and over again. Now, you might be saying, Jason, if you were a good sleep disorders technologist, which you're not, obviously, what you should do is put them on CPAP or bilevel, and all of that would go away. And I am here to tell you, this person has already tried that. And the weirdest thing is, this section here happens every single night they go to sleep. It happens with CPAP, it happens without CPAP, it happens with varying levels of bilevel. And I will say with bilevel, it does get ever so slightly better, but only with some what I would consider tremendously high pressures, or with low overall pressures of BiPAP, but with a very aggressive rise time. So it's just, I mean, when breathing out, it's dropping off. When it's breathing in, it is just like quick, fast to open up that airway. So we did a lot of that post MMA surgery, and it still persists. So that's the whole point of this. Even after a maxillomandibular advancement, sometimes it still does not address the root cause of the sleep disordered breathing, which appears to be subtle, like upper airway resistance syndrome tends to appear, but you often have to use super high inspiratory pressures to open up that airway fully. And it's just sometimes not something that the MMA surgery is going to address. Now, I know this appears to be like doom and gloom. I'm definitely, like I said before, I'm not saying all MMAs don't work. I'm just saying that this one did not address the actual concern. So what can you do about this? How can you mitigate this? Well, one thing you can do is have a drug-induced sleep endoscopy called a DISE. They knock your happy little tushy out, and then they scope your airway and try to see where the obstruction is. If it appears towards the upper airway, you're having things that are pinching in, collapsing the airway, those can be addressed with an MMA. But if it's much, much lower in the throat, that often cannot be addressed with MMA. So if that is a concern, MMA is probably going to be not something that you want to pursue. And I'm going to stress it again, talk to your doctor about this. Now, something that's kind of an aside to this, look at these are all premature ventricular contractions. And look, they are all occurring almost right at all the arousals. It's not artifact. This is putting a tremendous amount of stress on the heart. Take a little closer look here. Premature ventricular contractions galore. Look at all, we have a couple right here, almost near back to back. Usually when there's sleep disordered breathing, you will have stress on the heart. Premature ventricular contractions occur much more frequently. You stop the respiratory effort related arousals, and all of a sudden the PVCs stop. Now, you're probably looking for some words of wisdom from me. What's the fix? How do you fix this foolproof? I have a gentleman going through this right now. He has not had MMA. Super rare, but he's already been through bilevel. Now, he tends to get aerophagia on a lot of pressures. So that's kind of the thing that's causing the biggest issue in getting him treated. But he's now going down the path of considering MMA. And I'm certainly not going to say, yes, you should absolutely have the MMA performed. And mostly because it is such a radical surgery, it changes your face shape. And as you can see here, there is no guarantee that it's going to resolve the problem. At the same time, I certainly understand that people start to get desperate when you're not getting sleep. And you want to do really anything you can to get that sleep that you so desperately need. So in this case, it's really good just have a conversation with your doctor. Have a scan called a cone beam computed tomography. It can show you kind of a profile of where the obstruction could be. You can have a full-on DISE procedure like I mentioned before, and then have a conversation with your doctor. What will actually address these issues and these spots in the best way possible for the best outcome possible. Now, speaking of the best outcome possible, that's saving money for you. Now, if you want to try a bilevel, that's typically where we're going to get the best outcome possible. You can check out cpapsupplies.com and check out one of these super slick AirCurve 11s. Wow. That's advanced.
Wow.
Now, you could put this in your cart, but you're not going to save any money. If you want to save money, you need to go to the parts section. You need to go to the CPAP mask section. So let's go ahead and head here. And any mask you want. So go ahead, pick any mask you want. You pick the mask, and I will put it in the cart. You want the... Oh, AirFit N30i? Okay, let's put it in your cart. Now, like 99% of people are saying, that's not the one I picked. God dang it. And then like there's one person that's like, oh my God, he picked the one I said. Sorry about that. So what you're going to do is you're going to put this baby in your cart. I have something else in there. Oh, we have another mask in there. Okay, that's fine. This is going to work out beautifully. Look at this. We already put 2 masks in our cart. It was going to be $227, but instead it's $170.25 using discount code LankySpring. Now, if you want to save on other stuff, you can try the Hurricane Dryer. The Hurricane Dryer is phenomenal, and you can save, again, 25% off if you use discount code LankySpring. I want to say thank you to the sponsor of this video, cpapsupplies.com. Now let's head back, take a look at this. All right, at this time, I would love to beg you, if you would give this video a thumbs up if you enjoyed the content, subscribe to the channel if you have not yet done so, and I really appreciate you watching. Thank you. Goodbye. Clean your stinky mask with some Mask Bright, available at Amazon. And time for an extra thick thanks, buddy, to my top level supporters, Doug Toombs, Jason Georgiades, Patricia Espelong, Stuart Hetherington, Alan Liu, Edward Steiner, and I'd like to say thank you also to these people, as well as those other people. Up the ante, you get a shout out. Thanks for watching. Bye-bye. Barely even on screen, but still appreciate the support.